Good afternoon, Dr. Andy Kirshner here, and I'd like to thank you for stopping by the Backwards blog. Today I thought I'd do a brief post on disc replacement surgery. Now, I've been getting some questions on this. Last year I did a post on disc replacement surgery and I got a lot of questions and a lot of comments. In that previous post I had stated that disc replacement surgery is something that's relatively new. And while it is relatively new here in the US, it has been done in Europe and Asia for about 20 years. Now, they are doing a product here in the US that is pretty new, and the FDA is still doing protocol tests to see who's really eligible for it and who can benefit from it. And before we get to the basics of disc replacement surgery, I should tell you a little bit about discs themselves. Now, here's your spine. Take a look. Looks pretty complicated. But if you look, each one of these white sections here are vertebrae. And in between them, there are these gelatinous, fluid-filled objects, which are the intervertebral discs. Now, as you age, from the time that you're very young, the discs are actually pretty fluid-filled and more like water balloons. As you get older, the discs become thicker and more pliable, almost like silly putty. So that they do change as you age. Now, like any other part of your body, your spine can wear and tear. And what can happen is the discs can actually start to wear out. And they can get thinner, they can become ruptured or herniated, which means that some of the material, the nucleus pulposa in the center of the disc, can start to leak out and go into the space where the nerves exit from the spine, and that can cause problems. When it gets past a certain point and the discs have basically been eliminated and you basically have bone on bone and the disc itself is gone, that's when they start talking about disc replacement surgery. Now, you have a couple options. They used to do just a spinal fusion, where they would take the two adjacent segments of the spine where the disc had been eroded, and they would use bits of crushed up bone to fuse the two segments together, which would limit movement in that segment of the spine, but would protect the nerve where it exited from the spine. Disc replacement surgery is a more modern approach to that, where instead of actually fusing the bones together, they'll put in a synthetic disc, which is made out of a silicone compound that's designed to absorb shock and replicate the movement of this vertebrae. And they'll actually surgically file down the surfaces of the disc, insert it with some surgical orthopedic glue and sometimes some screws, and then it will basically replicate the movement of that disc and give a person movement at that segment, where previously, if it had been fused, they wouldn't have that. Now, the advantages of fusion were that you had a predictable healing pattern. You kind of knew once you did the fusion that the foramina, the holes where the nerves exit, would be preserved. The problem is that at that segment, when you fused, you lost movement, which meant that the adjacent discs, the one above and the one below, would have to absorb all the movement and function of the disc that's now gone. With disc replacement, you're trying to preserve that. Now, what that'll do is it'll make it so you still have movement. Now, in my own practice, as of now, I've had about 12 patients who've had disc replacement surgery. And interestingly, the statistics for my 12 patients mirror almost exactly the overall statistics for disc replacement surgery. And that is, approximately 1/3 of the patients get improvement following disc replacement surgery. 1/3 of the patients get absolutely no change following the disc replacement surgery. And 1/3 of the patients actually get worse. So the statistics, like for all spinal surgery, are not that great, and spinal surgery should always be considered a last resort after you've pretty much tried everything else. That being said, if you think that you may benefit from it and you are considering spinal disc replacement surgery, get a second and even a third opinion before you go ahead and get it, because this is one of those things where if there's a good consensus among physicians, you're probably going down the right path. In any case, I'd like to thank you for stopping by the Backwards blog. I appreciate your questions, comments, and input. Remember, your cards and letters are what keeps this blog interesting. And of course, feel free to check out my new book, 15 Surefire Tips for Relieving Back and Neck Pain, plus 192 others just in case, which is now available through Amazon and soon to be released on Kindle and Apple iPad format. Thank you for stopping by. Have a good day.